Nawasikia, naomba dakika moja, I'm trying to live stream. Okay, we are on YouTube. Karibuni sana Women Prayer Warrior, na leo tutakuwa na wazungumzaji wawili, Dr. Ruth Ogot pamoja na Sister Alice Moha, na leo tutakuwa tunaongelea habari za afya. Kwa niaba ya Women Prayer Warrior, nipende kuwakaribisha wote mliofika na wengine ambao wako njiani kufika. Na kwa kuanza, naomba nikabidhi kipindi hiki kwa Dr. Ruth pamoja na Sister Alice. Karibuni sana.
Asante Aunty Nanyuni, karibuni wote. Ni kipindi ambacho tunafanya interactive. Kila kitu ni kwamba based on our experience and what we've gone through. I think last time tuliongelea kwamba we want to discuss about anemia, kwa sababu anemia is very common on women than in men, and anemia, majority of us are facing anemia, or we have faced anemia somehow in our lifetime, or maybe sasa hivi. We'll just continue with English and Swahili. I think everybody's okay with it.
Yes.
Okay. Kwa hiyo mimi nitaanza kuwapa a little bit of introduction kwamba what is anemia. Kwa hiyo anemia ni kwamba katika miili yetu tuna blood, ambayo kwenye blood kuna function cells ambazo ziko ndani ya bloodstream. The biggest one hiyo tunaita red blood cells. Kwa hiyo anemia unakuwa na deficiency ya healthy red blood cells. Kwa hiyo tunajua kabisa kwamba red blood cells zinakuwa produced kwenye bone marrow, mara nyingi kwenye mifupa. Kwa hiyo mifupa ya miili yetu kule kwenye zile joint kubwa, kuna zile bone marrow. Just recently nilikunywa supu ya inaitwa nini Aunty Nanyuni? Makongoro. Makongoro for the first time. Nikaona kwamba pale unachukua uvute ile bone marrow ndani ya mfupa. Kwa hiyo pale ile bone marrow is a very very key thing to our body. Tunajua kabisa kwamba red blood cells ina biggest part ni kwamba ina carry oxygen kwenye parts zote za miili yetu. Kwa hiyo katika wanakwambia katika wanawake probably 10 watatu au 4 wanakuwa na anemia. Sasa kwa nini tunakuwa na anemia? Anemia ni kuna aina nyingi sana, na I don't think we'll go through those types of anemia, kwa sababu kuna microlytic anemia, kuna sickle cell anemia, kuna hemolytic anemia, kuna vitamin D induced anemia, kuna iron anemia. Sasa sisi tutabase anemia in a general sense kwamba you just need to know what is anemia and what happened, and then ukitaka kujua kwamba details kwamba una anemia itabidi uconnect na doctor ambaye anaitwa ni hematology, ambao wenyewe wana deal directly na blood na kujua kwamba what type of anemia unayo. The way wana diagnose anemia ni wanakufanyia blood work. Wakishachukua blood work wanacheki kuanzia RBCs, white blood cells, kuna vitu tunaita MCT, iron binding sites, which we call TBIC, ferritin, which is how much iron you have in your body, tunacheki B12, tunacheki folate, and the biggest plate tunacheki hemoglobin, hematocrit, ambazo most of the time ndio hizo wanakuambia kwamba your H&H is low or your H&H is 6 and 28, you need more blood. And then they also check something is called folate and vitamin D. As I see people of color or watu weusi or any mixed skin, ni kwamba we tend to be less on vitamin D. Vitamin D plays a biggest role in anemia, and it plays a biggest role in women health. Kwa hiyo wakikuchukua blood work wanacheki vyote hivyo kuangalia kwamba do you have anemia? So let's say doctor amekudiagnose na anemia, au ulienda kwa doctor kwamba una feel kwamba something is wrong. The biggest signs and symptoms that anemia, number 1, the key kubwa kabisa ni fatigue. Most of us unakuwa una feel kwamba you have no energy. Unaanza kuwa na kama palpitation or irregular heartbeats. A lot of people unakuta dizziness, kwamba ukiinuka una feel dizzy kwamba you're about to pass out. Ukitembea kidogo you feel dizzy. Sometimes people tend to feel nauseated. Skin inakuwa very pale. Sasa ukiwa dark skin huwezi kuona ile pill iko wapi. Kwa hiyo 90% ukiangalia ukivuta ulimi kwa chini kwenye zile mucous membrane unakuta yuko very pale, au unaangalia kwenye macho ukivuta kwa chini unakuta very pale. Ukipinch kucha kwenye kucha pale unakuta yani inakuwa very very light, like very pale. Ndo jinsi tuna diagnose kwamba anemia kwenye ukiwa na dark skin. 90% unakuta blood pressure iko juu. Na why blood pressure iko juu? Kwa hiyo ukiwa na anemia ni kwamba una less red blood cells kwenye volume yako. Kwa hiyo what tends to happen ni kwamba blood pressure ina compensate, moyo unabidi compensate kwa sababu kuna less volume ndani ya mwili wako. Kwa ile with every ejection fraction ya moyo inavyo pump with one pump inakuwa iko less. Kwa hiyo unakuta unatend kufanya nini? Kuwa na high blood pressure. Ile high blood pressure goes and causes kidney issues. Ikicause kidney issues 90% unaishia kwenda kwenye dialysis, unaishia kwenda kwenye problems za kidneys. Sometimes unaenda mpaka kwenye inaweza cause matatizo ya moyo inaitwa cardiomyopathy, kwa sababu ile the lower chamber of the heart ina pump so hard to compensate na ile less blood work in your body. 90% ukimwona hematology watakuangalia based on your height and weight and based on your BMI kwamba how much volume do you need to pump. And sometimes, you know, the biggest treatment is water. Once you drink so much water, your volume increase. Sometimes you even feel better. But ikiwa too low, then wanaanza kukupa different kind of treatments. Causes za anemia ziko nyingi sana. Number one, ambayo wote tunajua ni kwamba unakuta ni family inheritance, but family inheritance haina source kubwa sana. Source kubwa ni diet. Kwa unakuta kwamba tukiwa tumetokea kwenye third world country, tumepatwa malnutrition, a lot of people wamekuwa na kwashiorkor. Inakumbuka mimi wakati niko mdogo Tanzania kulikuwa hamna mchele, tukaitoa mchele kutoka Japan, kitumbo, sijui kama mnakumbuka. It's true, kikombe kimoja kinapikwa mnakula watu 10. I mean, tell me, how can kikombe kimoja kinapikwa ule mchele unavimba mnakula watu 10? Kwa hiyo yani kuna hizo side unakuta kwamba watoto wengine wanakuwa wamezaliwa baada ya miezi 3-4 wanaanza kuopewa maziwa ya ng'ombe, wanaanza kulishwa unajua uji wa mchele au uji wa mahindi. That is too early for a child development, na ukija kuwa mkubwa unakuja kukuta issue kama hizo za unajua joints, unakuta vitamin D deficiency, unapata rickets. Kwa hiyo the biggest one ambayo tunaiona sasa hivi na kwenye healthcare ambayo wengi sana tunaiface ni hiyo kwamba ni chakula, absorption of nutrients. Unakuta wengine wanakuwa diagnosed na a lot of stomach issues kama kuna celiac disease ambazo zina cause less of absorption ya hizo iron, ferritin and vitamin D. Wengi wetu hatuwezi kuafford kwa sababu yani ukitaka kuwa ukiwa na anemia na ukitaka kuitreat very well, I mean cost yake it's a lot kwa sababu you have to eat healthy, you have to buy vitu ambavyo you can afford. Kwa unakuta you know a lot of low socioeconomic people wanakuwa faced na anemia na they cannot afford. Another causes ni excess menstrual bleeding. A lot of women, we get diagnosed with fibroid at older age. Unakuta you are bleeding and bleeding and bleeding. Sometimes yani unaletwa kwenye emergency room, you have no blood kabisa, inabidi tukupe blood. Kwa hiyo that's another biggest cause. And then reduction ya RBC production, ambayo hiyo unakuta most of the time ni kwamba pending high blood pressure for so long, ambayo imeenda cause kidneys kuharibika. Kwa hiyo kidneys na produce something we call erythropoietin, na hiyo erythropoietin plays a big part kwenye RBC production. Dr. Ruth uko hapa?
I'm here.
Okay, kwa hiyo sasa tuta continue na Dr. Ruth ataendelea mbele na different treatments. And then kama nimeskip kitu au kama kuna mtu yote ana swali mpaka sasa hivi, it's an open discussion. Yani tunaongea, discuss, and then we'll move into the treatments and things to do to help us out with anemia or to treat the anemia.
All right. Thank you. Thank you, Alice, and thank you for a nice presentation. As you said, a lot of people, we see a lot of this in our clinical settings. A lot of patients want to wana iron deficiency anemia, and it's the most common minerals ambao watu wengi hawana. It's iron, and it's based on the causes, all the causes ambazo umetaja, like absorption, major thing why we don't get enough iron. Just to add on the signs and symptoms, you mentioned irregular heartbeat, fatigue, and those are major common ones, but there's some symptoms that might not come to mind. Maybe you have anemia, like air loss, you're just losing your air. Maybe when you comb, you have a bunch of nywele kwenye mkono. It's good to check your iron levels. Insomnia, as women, maybe, insomnia tulali vizuri, might think, maybe it's menopause, or maybe I'm just stressed. It can be related to anemia. Split when your nails are just dry and then zina crack, that might be a cause of anemia. And then you can't concentrate. Not concentrating can be another problem. Body pains, your body's just aching. The other one is, I think those are some of the symptoms. So when you have those symptoms, maybe you're not fatigued and you don't have irregular heartbeat, but you have those symptoms, let your doctor check your iron levels. So when it comes to the treatments, the one cause of treatment is to find the root cause, how to treat anemia. What is causing? Is it that you're bleeding? If it's bleeding, then your doctor needs to treat that. Is it you're not bleeding, but the iron is not being absorbed in your system based on either poor absorption? So you have to tackle the problem which is causing your iron to be not absorbed. Things like Alice mentioned, like stomach issues, people with irritable bowel syndrome, that will cause iron not to be absorbed. Some other things is if we have antacid, like acid reflux, and then we are using antacids, that will cause iron not to be absorbed. Using too much calcium, if you're drinking too much milk, the iron will not be absorbed. And that's why at times, Dr. anakuambia, before you take your medications, take your iron pill 30 minutes before or after using milk or taking your antacid medications, if you're using antacid medications. So the other major thing is, for the iron to be absorbed, you need acidic environment. If some of you might remember, if they're using the iron pill, daktari atakwambia, what we tell them, you take it with vitamin C. Why? Because for the iron to be absorbed, you need acidic environment. So most people, if you have acid reflux, meaning the stomach acid is not acidic enough to help the iron to be absorbed. In such kind of cases, we recommend apple cider vinegar to create the acidic environment, but you have to be careful with apple cider vinegar. If you're using apple cider vinegar and you have epigastric pain, meaning you have ulcers, there's irritation, you have to see your doctor if they have to do EGD. The other thing is consuming too much coffee. I'm guilty as charged. I drink too much coffee. Drinking too much coffee, using a lot of turmeric, this blocks the iron absorption, because coffee, tea, and turmeric has what is called polyphenols. So the polyphenols in coffee, tea, and turmeric, if you're using it, of course, if you're using it too much, it's going to block the absorption of iron. And when we go back to the Bible, God tells us everything needs to be done in moderation. There's a reason why God gave us this. So do this in moderation, the iron will be absorbed. What else did I miss? So the treatment is finding the root cause. If you're not a vegetarian, red meat, spleen, liver has a lot of iron. The iron pills that we use also, it's called chelated iron. Some are plant-based. You can use some plant-based iron supplements if you don't eat red meat or spleen or liver. I have another one. I'll share the box of the one that I'm using because I have iron deficiency. And like Alice had mentioned, most of the time, if you have low iron, you are low in vitamin D. It's almost 95%. So whenever you have low iron, if your vitamin D levels are not corrected, you're going to be taking iron, but it's not going to be efficient. So all of the time, ask your doctor to check your vitamin D. And I've experienced this with my patients. Most of the times, depends with the insurance that you have. Vitamin D levels is allowed to be checked once a year when you go for your annual physical. As far as California is known, that's what I know in California. I don't know about other states. So if you're going to do it before your annual physicals, you're going to have to pay. So I would rather pay so that you know your vitamin D levels are optimal for iron to be absorbed. Okay. And there's what we call, okay, before I move forward, questions? Any questions? Okay, I'm going to say this because most of the time you go do your annual labs, but your hemoglobin levels are perfectly fine and your iron levels are perfectly fine, but you still feel all these symptoms and you think, am I going crazy? And even your doctor might say, no, I've checked everything. Everything is fine. So at that point, ask your provider to check the ferritin level because that's what we call non-anemic iron deficiency or subclinical or pre-anemia iron deficiency. So what happens, the iron levels will be normal, but the ferritin levels were not checked. So you're going to find when the ferritin levels are checked, it might be low because we need the ferritin to store and release the iron in the blood. So whenever it's low, you're going to be feeling all the symptoms and the fatigue. Some conditions, and there's some conditions that might mimic. You might find like, okay, your ferritin levels are normal, things like inflammation or infection. So if you have inflammation in your body, which is caused by stress and other things going on in our lives, your ferritin levels might be normal. Or if you have any infection going on. So whenever your H&H is normal, but you're still having these symptoms, your thyroid is being checked, other things have been checked, don't think you're crazy. Just ask your doctor, can we check the ferritin levels to make sure it's also normal? So we welcome questions, any additions?
Just to add on that, Dr. Ruth, I mean, I remember on my first pregnancy, I was really young. I was 19 when I got pregnant with my first one. And the doctor said he could not do a cesarean section because I have very, very small hips and I couldn't deliver naturally. Kwa hiyo wakasema hawawezi kufanya cesarean, hawawezi kufanya C-section until my hemoglobin and hematocrit got higher. Nikakumbuka nyumbani, unajua nyumbani tuna yale maua yanaitwa choya, hibiscus flower, I think wa Mexico pia wanayo. Unayachemsha yale and then unakunywa kama chai. That really, really helps with anemia. Not only that, ribena, tuliyotokea Tanzania kuna ile juice ya ribena. Unakunywa, unajua everything excessively is not good. Lakini kama unakunywa a shot, asubuhi kwamba a little bit of glass unakunywa ribena, really, really helps. Kitu kingine ni maini ya ng'ombe. Maini helps tremendously. Hakuna kitu kina loaded on iron kama maini. Being vegetarian, maybe you cannot use maini, lakini kuna fruits ambazo unaweza kula, ambazo tunaita zinakuwa zina a lot of beta carotene. Kwa hiyo kila hizo fruits kama apricots, beets, they increase your levels right away. Not only that, ukiwa unakula hizo iron pills ni kwamba you have to add something to make your body absorb the iron. Kuna rafiki yangu ametokea Costa Rica, ambaye nilikuwa naongea naye, nikamwambia ananiuliza unafanya nini? Nikamwambia I'm just looking on things about anemia because we had a lady that we were transfusing blood, and this lady comes every maybe week to the ER and blood levels are so low. Akamletea chupa kutoka Costa Rica inaitwa caral fruit. I've never tried myself, but I went and Googled to find out what is that caral fruit, and it seems to be very helpful, something that, you know, whoever is anemic wants to try. Probably we could probably look through these healthy stores like Sprouts or Jimbo or Whole Foods. I know Whole Foods is all over United States, and see if they carry them. The iron tablets are very strong sometimes on your stomach kama ukiwa una weak stomach. Kwa hiyo there's other medicine ambazo unaweza kufanya ambazo they are more natural kusaidia kwamba ku improve that anemia. Ukiachia anemia for so long and your levels are so long, the first symptom that comes, the first problem is usually high blood pressure. Kwa ukishaanza kuona kwamba blood pressure iko juu and you're anemic, kwamba there's a problem, you have to, you know, find your hematology and then make sure that you follow through. Sijui kama nimesahau kitu chochote. Kama kuna mtu ana swali anataka kuweka nyongeza. All this information is just, you know, dealing with patients on daily basis, things, experience that we've gone through. Kama kuna mwingine ambaye yuko kwenye medical field, nutritionist, case manager ambao they've gone through the same, or maybe refer patients to some type of an outpatient treatments, you know, maybe unaweza kuingia. Dabet, naona umenyanyua mkono, karibu.
Asante sana for such profound information. Kwa kweli hiyo ni kitu ambacho nadhani katika vyote is very great information. Asanteni sana. My question ni kwamba when you're trying treatment, kama hutaki treatment unatumia the natural stuff, wana jina lake, is it called something medicine? Hutaki kutumia either kuongezwa damu, unataka kutumia vitu natural.
Homeopathic.
What is the best advice if your blood is very, very, very low? Lakini unaamini Mungu atakusaidia, naamini, what are the best foods kutumia?
So most of the time ni kama hizo, ni kwamba the biggest one ni kwamba you have to change your diet. Kama kuna hizo natural stuff ambazo nime-mention, unaweza ukajaribu kwanza hizo, and then you have to make sure kwamba kama uko very low, at least you get monitored every 2 weeks kuona kwamba are the levels going up or are the levels going low. Because sasa hivi tunaweza kuenda kwenye Amazon ukanunua like a finger prick kama tunazotumia kwenye diabetes kucheck blood sugar, ambayo unaweza ukaprick, inakupa your hemoglobin A1C na inakupa your RBCs, your hematocrit na HGB. Kwa hiyo unaweza ukaangalia pale weekly, kwa sababu una prick your finger tu, hauna haja ya kwenda kutolewa damu, na ukamonitor mwenyewe kuangalia kwamba which way unaendelea. On the other side, you know, as we do this treatment, we also have to pray, kwa sababu tunakumbuka kwamba Jesus died on a cross and took all our sickness and all our pains, you know, and remove everything from us, you know, so that we could be healed. So we have to have a faith and we have to pray and leave it to God, knowing he died on a cross for us so that everything can be healed. Sijui kama nimekujibu Dabet.
Umejibu, asante sana. Asante. Hiyo ya kutizama damu every 2 weeks, that's great information. Asante.
Yeah. And you can just buy on Amazon. Actually, they sell them on Amazon. Una prick your finger and then it gives you the number. Then you can see, okay, this much I've done, you know, maybe let me add on.
Sister Becky, to add on on what Alice has said, using natural therapies is important, but at the same time, how low is low? When your hemoglobin, your blood level is low, how low? Because based on studies, any hemoglobin level below 7 or below 6, meaning 5 and below, you should be transfused. Because right now, damu inavyokuwa chini that much, it's like you are running on an empty tank. It's so easy for you to have heart attack. So when it's that low, I wouldn't encourage you to use the natural. No, go get your blood transfusion. Let it be like level 7, level 8. Then you can continue with the natural medications. I know as
Dr. Ruth,
yeah.
naomba ni kuinteract kidogo. How much do we supposed to have? Because niongezee hapo. If 6 is low, and what is the reasonable amount?
This is based on science. Anything below 7, you should be transfused. Depending, lazima when they are. If it's below 7, I have to call you. And if you don't want to go to the ER, I'm going to write it. Patient noted with the dangers. Anything happens, we are not responsible. This is a country where we sue everybody. But not alone suing, it's not safe because moyo itakuwa inapiga sana. You only have a little in the heart, and the heart is really pumping to supply all the body with the oxygen using the blood. Kwa hiyo utakuwa na heart palpitations, and it's so easy for you to have heart attack. So have it to the level whereby it's at least 7 or 8, and then continue with the natural remedies and find what is the cause, what is causing you to lose blood. Are you bleeding internally? Is it because of your menses? Is it because of the chronic condition you have? Because based on what is going on, either your doctor atakwambia, we're going to manage it, or we need to transfuse you.
So just to add on that, Auntie Nanyuni, normally 11 and 32, 11 and 33 is a normal for like any women. But the number can go lower because depending on your height and weight. Kama you're very petite, like I'll give you an example, somebody ambaye ni mfupi, unaona, kama Hispanic community wengi wako ni wafupi sana. Kwa hiyo kama ni mfupi sana, huwezi kusema hemoglobin yake na kama mimi ambaye ni 5'9" tuko sawa, haiwezekani. Kwa hiyo unategemea na BMI, height and weight, kwamba uko kiasi gani, kwa ile hematocrit inakuwa based on that. Kwa hiyo anaweza akawa ni mfupi, maybe 5'1", akawa na H&H ya 7 or 8 na 26, akawa yuko okay, lakini kwangu mimi 8 I can't function. I have to be at least above 9 and you know, up. Kwa hiyo most of the time inakuwa very specific based on your height and weight. Ndo wana calculate kwamba okay, where should you be? But normally, like Dr. Ruth said, ukiwa kwenye 7, hata kama wewe ni 5'1", yani pale tayari kuna tatizo. Na unakuta kama uko kwenye umri wa 40s, unakuta kwamba 45 unaanza kusema oh, menopause imeingia, menopause. Moyo unapiga sana na sweat. Sometimes it's not even that. Sometimes you know, your levels are so low. Anaona kuna mkono kwenye iPhone 214-908-5005, sijui ni nani. Karibu.
Pia
Oh,
Dr.
thank you,
Maria alikuwa na
Alice.
hand up.
I have a question for Dr. Ruth on turmeric. My question on turmeric is how much is too much? Because we use it for cooking, and I just wanted to know if the one we use can affect the absorption, then just to be aware how much.
Can I answer that, Dr. Ruth? So the turmeric, it's used as kama spice. It has very, very, very little effect kwenye absorption, kwenye iron. The raw turmeric ambayo unasaga au unakunywa, kama some of them kuna zile liquid cups za turmeric, those ones works better. You can still use on cooking, lakini yani absorption yake na effectiveness yake it's very small. Ni sawa na kama garlic ukiwa unapikia, it lowers your blood pressure but very little, lakini ukila garlic peels au ukila the actual raw garlic is even better.
I think this is based on what we're now kunywa turmeric tea. You're gonna have 3 cups a day, every 5 days a week. 2-3 cups of coffee a day, like me. I have to do that to function, unfortunately. So such kind of stuff. So when it's too much, when we do too much, but just a little of the spices that we use, maybe a cup of turmeric tea every day should not. But at the same time, make sure your levels are within normal limits if you have anemia. Iron deficiency anemia, I'm sorry.
Okay, I think Dr. Maria was next, Auntie Nanyuni?
Yeah, and then Sister Esther.
Maria.
I'm on here. Thank you. I was trying to quiet my surroundings. Thank you, Dr. Ruth and Auntie Alice. I just wanted to just add a few verses just to kind of remind ourselves how important this information is. In Leviticus chapter 17, it says, "For the life of the flesh is in the blood."
Amen.
All throughout the Bible, God had put information of the importance of the blood. And as we're hearing this information, it's so critical because with the blood, that's where the oxygen and the nutrition and everything flows. We don't want to be in a place where we people suffer because of the lack of knowledge that we have. So I really appreciate the knowledge that you're presenting today. And also, I'm happy how we are able to talk about both naturopathic ways and medical ways and how you can utilize both. Sometimes people who utilize naturopathic ways are there, it's either science or naturopathic, but you can actually do both, like just like Dr. Ruth said, you can utilize the labs and know what the numbers are and consult with your doctors. At the same time, with your daily use, you can use naturopathic ways to boost the body and so forth. I'm laughing because the Holy Spirit really had spoken to Dr. Ruth and Auntie Alice, because my 5 minutes today was also about bones, but it was talking about stress and how it affects the bones, because the Bible also says that when we don't have positivity or having positivity or positive things in our lives, it dries the bones. How amazing is that? Kila kitu ambacho tunajifunza kuhusu afya kiko kwenye Biblia.
Mm-hmm.
Hata magonjwa yote ambao infection and everything is in the Bible. God already declares kwamba yani uhai uko kwenye damu. Hata ukiangalia kuhusu COVID, I laughed kwa sababu it talked about how they used to isolate people. Iko kwenye Biblia. So I pray that as the health ministry leaders here give us this information, tusikilize kwa roho ya kuchukulia mawaidha, but also because God wants us to be at our optimal health, having enough oxygen to be able to think and process so that we can be able to react and process the things that we have to go through each and every day. For those who've experienced anemia, you also know kwamba it starts with you even just being confused and having no energy, and imagine how that affects you as a mother and as an employee and even as a person, kwa sababu pumzi ambao unayobeba juu haibebi na damu kwa sababu damu imepungua. So God bless you, ladies, and thank you so much for this presentation.
Thank you. Dada Auntie Esther, naona kuna mkono.
Thank you, Sister Alice and Sister Ruth, for the wonderful information you're sharing with us. We've been blessed. I had a question about vitamin D. I think it was mentioned that sometimes there's a correlation between vitamin D deficiency and anemia. Mm-hmm. So my question is what are the numbers that we should be looking for vitamin D? And so what is considered low to where it should get our attention? So that is one. And then the other one is, as far as, some of us are also raising children. And sometimes our girls, when they're on their periods, you can find that a child is really suffering in terms of course, the pain related to that, but they might be complaining also of being really tired or even feeling like they're running out of breath. Should there be a concern that they might be anemic, or is that just not normal? So I'll stop there.
Okay, the normal vitamin D, like we had mentioned, there is a lot of correlation, like 95%. If you're low in iron, you're going to find you are low in vitamin D. Why? We found one of the reasons why iron is not being absorbed is because of inflammation. Vitamin D plays part in helping with inflammation. So when you're taking vitamin D, the inflammation is being taken care of. Then your iron levels will be the iron will be absorbed wherever your ions you're getting them from, either from food or from the medication. So it's very, very important. The normal level should be 30 to 100. So whenever you are below, if you're below 30 as like 26, that's insufficient. I'll tell you to go get over-the-counter vitamin D supplements. Whenever it's below 20, like 15, wherever, your doctor should prescribe you vitamin D, the weekly, the 50,000 units. You take that for weekly, at least for 3 weeks, and then recheck your levels, because also we don't want it to be too much. We go back to the Bible, everything in moderation. So if your levels are between 30 to 100, you're fine. And you have to ask. If you don't ask, because most cases, especially in California, for the vitamin D is covered if the patient is obese or if the patient has any psychological issues like anxiety, depression. That's when you order the vitamin D levels and the insurance will cover. Otherwise, the insurance gonna bill the agency if you're working mostly like in QHC, the community clinics, because we are federally funded, the labs, the bill will come back to us. If you're in private, the bill will come to you.
To add on that, Dr. Esther, I mean, I don't know about the clinic, but I worked on the urgent care and emergency room. 90% when the girls start their period, there's a lot of emotional parts that comes with the girls. So in the beginning, usually doctor hawatakucheck wala kukwambia kwamba kuna anemia pale mpaka wamesha normalize on their circle. Kwa hiyo kama sasa hivi wasichana wengi sana period wanaanza age 10, age 9, very young. Kwa hiyo doctor hawataprescribe, hawatakuambia anything mpaka majority mimi nimeona on my cases ni kuanzia age 14, 18. Doctor anaanza kuambia kwamba okay, here we see there's an issue, here we see there's probably a problem. But when they just started, probably usually I don't think they prescribe anything. I haven't seen it on my practice, yani kwenye wagonjwa niliopitia.
So the other thing, Esther, as people of color, it's so sad to say, and it makes me sad. When we voice our concerns, it depends with the provider we're seeing you.
Mm-hmm.
Might take it seriously and say, okay, let me order iron levels for this little girl she's fatigued, because maybe she's bleeding too much. What do we consider bleeding too much? Are you changing more than 5 parts in 1 hour? And how soaked are they? For me to consider you bleeding too much. Normal bleeding is 3 days to 10 days. If you're going over 10 days, that's abnormal. So as Black mothers, I don't know, they're white mothers as well, but it's not bad to say, please, can we just check in this? Can we just check iron levels to make sure that everything is fine? So that's why it's very important to have one provider and you form a relationship with this provider. Because if you come in with a list of things you want me to do, Oh, it depends. I'm not going to do it because it's like, okay, you came in with the transcript. You just want me to follow through. So having one provider, you have a relationship. They know this patient. They know something is going off. Ask them, can we just let's check iron levels. Maybe that's why she's tired. So it's not bad to ask. And as women, of course, we're going to be judged. Oh, she's too needy. She's all this, but okay, call me needy, but my kid's condition, whatever she's complaining of, is taken care of.
Yeah, thank you. And I agree with you on that last comment about how we probably have to push harder than others when we are, especially from outside of this country. They don't necessarily always believe us or think we understand our bodies. Sometimes there's an assumption that you're either being an emotional or just being a woman. I had a male doctor recently actually make that comment to me, telling me that yes, sometimes women are just considered as being emotional, and you may have to go back to the doctor 2 or 3 times before they actually take a step. But I wanted to revisit the point of vitamin D. So if somebody has a level of 14, it sounds that is really low from what I'm hearing.
Mm-hmm. That's critical low. So with that level, you will probably need, they call sub-Q shots, where they inject it on the skin. Is it sub-Q, Dr. Ruth, yeah?
Yeah, don't do sub-Q. Maybe when they're inpatient. Outpatient will prescribe 50,000 units every week for 3 months.
So that's 50,000 units once a week.
Yes. And
so you can do the ones from the store. I think they're usually 1,000 or to 2,000 IU. If you do 2 tablets in the morning and 2 tablets in the evening, to reach the goal of 50,000 per week, it's fine, because you don't want to drink the whole 50,000 as one, unless if it's prescribed. But you could do, just like over the counter. Vitamin D is the key also for losing weight, kwa sababu unajikuta tumefikia miaka 40, unaanza kushangaa, how come I'm exercising every day, I'm eating healthy and I don't lose weight? Vitamin D plays a big role for us, people of color na watu weusi. Unakuta sometimes wanakuja emergency room, they're pretty sick and their vitamin D is kind of like that, like 14 or 10. Ukishaona ile vitamin D umeimprove, yani imefika kwenye 30, yani you feel totally a different person.
Thank you.
Sometimes it's very low.
Sometimes
if you're very low, doctor wako anakupa hizo sub-Q shots kama vile unavyochoma insulin. Wanatumia the same needle, very small needle, wanakuchoma on the back of the arm or on the thigh, once a week for 2 months, kuangalia kama ime pick up or not.
Yeah, the instructions we got was just to take that 1,000 once a day, and there was no even follow-up setup. So I'll go and I'll follow up on that. Thank you very much.
Yeah, and I'll post the brand. Kuna some brands okay, but you want to get the one with the jelly caps. And I post kwenye Women Prayer Warrior kwenye group kama mtu anataka kununua, kwenye hizi one of the healthy stores. Ambayo ukitumia yani absorption yake it's very fast.
Thank you.
Niliona kuna mkono kutoka kwa
Sister
I
Kia,
just wanted to say something about medical care. Most of the time, people really, if you have an accent, they just assume you don't know anything, because they do that. And thank you for mentioning that, because sometimes we have insurance, we don't go to see the doctor except when we are sick. So I think those are important things for us to know. When people look at you and they only see you a visitor in emergency room, they already put you in a certain place. And us as people of color or foreigners who are here, we have to be our advocate for our people. these days, if they mention a name that is difficult to mention, and I know it is African, and we are on the table and they're ready to chop them, I say to myself that, you know what, I am the advocate for this person, and I have to speak on their behalf, that which they can't speak. I just thank you so much for this information, and they can help us also to take our healthcare, to prioritize our healthcare. Thank you so much for the presentation and all the information today.
That is every single day. I came to work today, and I'm doing what we call offload, where you're dealing with the paramedics. And because the volume is so high, patients are so sick, so we just load them on the hallway. So we have this traveler nurse that I've never worked with her before. She just comes over and she's like, "Oh, you cannot triage. You are not qualified." And she just goes off. And I just sit on the side and I looked at her and I said, "Oh, because I'm Black, or because I have braids, or because of what?" So we have to stand up, guys. We have to prove every single day. This just happened today that I just looked at her and I said, "You know what I'll do to you? I'll pray for you." And she just looked at me like, because she thought I'll, like attack or say something. But I'm very passive aggressive. I just looked at her and I walk away. And then she came and realized, oh, this nurse is very qualified. So she backed off and said, "Oh, I think I'm just going to do this and this and this." I'm like, you do what you want to do. So we have to, as women, as mothers of our children, we're giving you this knowledge. This is from our experience. This is not from a book. This is not from a Mosby. It's something that we do every single day. And because we are passionate with what we do, and because we love everybody on Women Prayer Warrior, take this, take it to your doctor, ask information, bring it back to us, and then we can assist you. Not only that, we're here as one family. Dr. Blantina,
Thank you.
Nitaka kusema tu asante sana kwa information ya leo, Alice na Dr. Ruth. I'm one of the person who maybe have been on both sides, low vitamin D to where I went to 9, and also anemic. And kwa hiyo nashukuru kwa hizo information. I'm just blessed that my doctor is integrative medicine, kwa hiyo anatumia natural and medical. Kwa hiyo aliweza kunisaidia kwa kutumia vyote. Kitu kingine alichonisaidia ambacho najua ulimention maini ya ng'ombe, maini ya kuku pia yako very high in iron. Nilikuwa nakula ayo maini ya kuku and I'll never look at it the same again. Alafu kitu kingine ambayo ilinisaidia pia ni blackstrap molasses is very very high in iron. Ndio nitaka kuongezea, lakini asante sana kwa information mlizotoa. Very very important, especially for women.
The other thing I want to add, and being in the field, I see people of color, leave alone people with the accent, but Black people here, when you go into the room, yesterday I walked into the room, this lady's shocked, like, "Ooh, I've never seen a Black provider here." So the kid, 11 years old, headache, I'm like, "Is he been seen in neuro or the primary been referred?" She's like, "No, I don't have a PCP. Why? Whenever I go, there's no Black person. The way they treat me is different." So this little girl is suffering. It's been 2 years, not been taken to a PCP. So wherever you are, find a provider. Not all non-Black providers are bad, but go form that relationship. Don't jump from one person to another, because when you're jumping from one doctor to another, you're giving history every now and then. But if you stick with one person, they know your history. Because at times it's not just your body. Maybe something going on at home is affecting you. So once they know you, they will be able to help you in that way. Because at times our patients who just break on, "You know what, my grandson is sick," or "this is going on." So please, wherever you are, find a provider and don't jump from one provider to another. Find a Black doctor, somebody who understands our culture, because even the approach is different. I talk to younger people differently. I found it's funny. I go in young girls, I'm like, "Hi, beautiful, what's going on?" They will tell me everything, the ones who are not shy. my Black people, I go in, girl, what's going on? So I have the language, because I know if I call her girl, she's not going to be upset. My brother, what is going on? Your blood pressure is high. What is going on? They will be open to tell me what's going on. So find a provider, ask God to lead you to the right provider, and stick to them. Thank you.
Niliona Dakei amekuwa na mkono, sijui naona ameondoka. Aunty Nanyoni bado yupo?
Hey, yupo.
Niliona amenyosha mkono, sioni tena simu yake.
Nipo. No, nipo.
Karibu Dakei.
Asante. This is very interesting. This is ni somo zuri. Mimi, my only thing nilikuwa nataka kusema ni just to add on to today's topic. Unajua privilege nyingine tulionayo is pamoja na all these complications, the anemias, na the deficiencies, you know, vitamins, like that. Nafikiri so kama Wakristo, kama watu ambao tumepata privilege ya kuwa na information nyingi, tuangalie hata vitu vya kufanya chakula. Unajua privilege ile sema ni is better than, and I think nilipokuwa nifika nchi, nilikuwa na rafiki mmoja Mjamaika aliyewahi kuniambia to be ready, akasema what you're doing now,
good night.
7 years now, you can't tell me kwa sababu 7 years kuona matokeo ati, you know, I mean, kwa hiyo kitu ambacho nilikuwa na kushare ni lifestyle. Hata lifestyle, kama kuna njia yoyote kuanzia watoto wetu, the young people, going back to moderation kama tunavyofunzwa katika kanisa, na kujaribu, unajua, mazoezi, yani vile vitu ambavyo hata kama genetically nitakuwa predisposed ku madini, lakini baada nipate 5 years from today. I think when you went, you know, once you get 40, oh my goodness, all the lessons, they come back, because now the body is no longer the same. Vile vitu vyote ambavyo uliwahi kuvisikia unajiona hapana, it's not going to happen to me, they catch up. Na mimi hata mabinti naenda kwa daktari wananiambia, oh, anaonekana na anemia, you know, I'm just trying kwamba labda hata kwenye chakula nifanye nini. Kwa hiyo wote tunafundishana mbadala, instead of the pharmaceutical medications, labda kwenye diet yetu, mazoezi, just our regular life, what can we do kuprolong uwezekanaji wa kupata hiyo condition, iko ni genetics, to avoid. Lakini chelewesha, instead of kupata na miaka 35, 5 would be okay. Instead of 45, 50 would be okay, or something of that sort. So that was just my kwa upande wangu, na from, you know, the medical aspect, kwamba tujaribu all we can also could change our lifestyles and the things we do on a daily basis, the food we consume, the life we live, tuweze prolong some of these conditions, labda zije later, much later, to live a meaningful life. Asanteni.
Thank you.
Asante sana. Dr. Ruth, siwaoni na Auntie Alice.
I'm here.
Okay.
Niko njiani da.
Hamna shida. Bado tuna dakika chache, maybe kama kuna mwenye swali, kuna comments and suggestions. Yeah, karibuni.
Najua nimezungumza, lakini I just want to say thank you kwa sababu alivyozungumza Kay na Dr. Ruth na Alice na wengi. Hii pia ni kumbusho. Sisi kama binadamu tunasahau sana, kwa sababu maisha yetu yako busy sometimes. we wanna make things easier, lakini hii information haitusaidii sisi tu, lakini hata watoto wetu tukianza kuwafundisha kuwa na physical check-up, see your dentist wakiwa wadogo, kuwapa katika habiti ya kujipenda, kujiangalia, na to share with our friends what we've learned. Kwa hiyo nasemeni asante kwa wote ambao mmeuliza, mmeshare. Mungu awabariki.
Amen.
Amen.
Naomba kumalizia, mimi nitawakimbia.
Auntie Alice, kuna swali, Dr. Ruth, kuna swali kwenye chat linatoka kwa Lily.
Naomba some.
Is there any way to regulate blood flow kwenye MP kama inasababisha anemia?
Most of the time ni hormone control, hormone changes, kwa hiyo ni birth control pills. Now, sometimes they are not very good because they have a lot of side effects. Sidhani kama kuna any other way, lakini ukiweza kucontrol, unaweza ukacontrol na food, kwa sababu kuna vyakula vingine ambavyo they have a lot of estrogen, ambayo kama wakikufanyia test wakakuta kwamba 90% ukiwa young ni kwamba wanakupa food ambazo ziko high in progesterone kupunguza ile flow ya menstrual cycle. Kwa hiyo unaweza ukatumia food, lakini 90% ukiwa young, kama vile umeanza tu period, unakuta watu wengi unakuta wanapitia phase kwamba they bleed, alafu ina stop au ina change. Lakini 90% ukienda kwa madaktari wetu wa huku ni kwamba watakupa hizo birth control pills, au ukiamua mwenyewe ni kwamba inabidi investigate, alafu una change diet kama soy products ambazo wanakuambia later on ukija kufikia kwenye menopause they are not good, lakini at that time kwamba unahitaji kwenye menstrual cycle they work. Food high in progesterone they work. Sijui kama Dr. Ruth unala kuongeza.
No, you're right. Based on kama utaki kutumia iron, that's what we give them, iron pills. Because I don't know, America, of course, we're trying to do this, but at the same time, kuna hizo controversy. Why don't you use Western medicine compared to that? Kwa hiyo utamwambia mgonjwa option. Hizo plant-based solutions are there. Now, as young girls, whenever grow, itakuja regulate. Unless if they're very, very anemic, then you can resort to iron infusions. Yeah, but as a parent is always, and even as a patient.
Lakini nadhani Dr. Ruth anaongelea kwamba how can you stop, or what can you do?
How can you stop?
What can you do to help, like with the heavy bleeding, like menorrhagia?
Yeah, birth control pills, and like you said, kama mtu taki kutumia
food.
Food, use the food.
Kuna natural hormones too ambazo unaweza kutumia is older in menopause, unatumia in the young kids to regulate.
Yeah, but always it's better to check with your doctor. All this information, I just have to give disclaimer. It's not supposed to replace any treatment you are on. Before you do anything, check with your primary doctor if it's safe.
Yeah, I find that the doctors first, I think, place they go to is to write a prescription or to give you medicine, or even like in the case of when you're bleeding too much, is to put a child on a birth control pill. They don't really necessarily talk to us about, oh, you could use diet, or there are some natural ways of doing that. So as a parent, without, I'm glad you all have mentioned a couple of other options on this call, but without that, sometimes a child is left to be put on birth control, and that that's not what you want for your child, but that's what the doctor is prescribing. So, and then also you're like, they'll be on that for how long? So that's also another issue I've had, just sharing with other mothers. How long can a young person be on birth control to control this kind of situations?
So as a parent, when you go during the visits, the decision patients make is shared decision. I'm going to tell you, I want to put the kid on birth control pill. As a mother, you have the right to say yes or no. So when you say no, you're going to give me the options. Okay, I don't want her to be on birth control. Can we do A, B, C, D? So you go in with already plan A. If I don't want the pills, I want the doctor to do this. Most providers, they will be easy. They won't disagree with you. They will be like, okay, you go try the diet. Let's recheck the labs either in 2 months or 3 months, or in between. If the condition gets worse, come back. So always go when you're going. We are too busy to tell you the truth. I have to be honest with you. We don't have time. I'm seeing 4 patients in 1 hour. So there's no time for me to go in and Google these are the options. But if you come in, you tell me, okay, you want to put on birth control, but I want us to try ABCD. I'll agree with you. And then we're going to do this and then come back in 4 weeks for us to check the levels. So always do your assignment first. When you go in, when they tell you, I want this, tell them, no, can we try A or B?
I'll triage.
I hope I answered your question. I know this is a lot of frustration parents go through, or they just gave me a prescription. No, we don't just give prescription. Based on data and based on the medical condition you're presenting with, that's what I'm supposed to give. If there's any alternative which have evidence that it's been helping, talk to me or tell the provider, I want us to do this. I'm gonna note it down because people sue a lot. Because if I don't give you that birth control pill, this kid bleeds to death, their license is on the line. But if you tell me, I'm gonna try beans, I'm gonna try liver, I'm gonna write it down. Mom wants to try natural therapies. We're gonna follow up in 4 weeks to check the levels. Condition changes, please bring the kid back. So always do a little bit of the natural remedies that you wanna use. And when the doctor wants to give those Western medicine, you have the option that you wanna try. In that way, you're not gonna collide with the providers, no. Because one thing that providers don't like, when you're coming in to help you, but already you have what you want me to do in your mind, most of the time, I don't know, there's a conflict. Because it's like, if you knew what's supposed to be done, why are you coming to me? It might sound rude, but that's how we take it. You know the treatment, so what do you want me to do? So I'm just giving you tips, what is going behind. They won't tell you, because here we're gonna smile and yet inside they're burning. They're not gonna tell you. So do your assignment, what you want, and in a gentle tone, as Black women, they're gonna say, oh, she was rude. She came in with what she wants, blah, blah, blah. No, can we try this? I'm gonna come back, or if any changes, then I'm gonna come back. So you wanna try those tricks and then it's gonna work. And you're gonna have an easy visit with your kid's primary doctor. I hope that helped.
The visits are easy, but yeah, that helped.
Asante sana, Dr. Ruth. Sister Esther, I think you got some good
and you
information.
can call me, Esther, call me. I know it's frustrating, you can call me.
Dr. Ruth and Alice, asanteni sana. If there is more questions, we can still reach you out. Yeah, anyways, in a group or in a private setting. But we really appreciate all the information that we have shared. Asanteni sana ladies kwa kuuliza maswali, na naamini kila mtu amepata jambo ambalo kwa namna moja ama nyingine linaweza kumsaidia. And we can share the information with others. And the good thing, we have it on YouTube, so it's there for us to revisit. Asanteni sana.
Naomba niwaachie Auntie Nanyuni just something. Kwenye Exodus 15:26 inasema kwamba we are confident that healing is for everyone. So as you live, you know that it's in the Bible, Exodus 15:26, that healing is for all of us.
Amen.
Mwema mimi nawakimbia.
Amina, asante Auntie Alice, Mungu akubariki sana. Dr. Ruth, kama bado uko?
I'm here, and the other thing I wanted to say, Nikwamba, next week, for the coming topic, if there's any topic that of interest that we need to talk about, common issues that mostly I hate to say the word Black women. Of course, everything that is bad in health-wise is about people of color. I don't know why, but we have those top. I asked my professor, he never gave me an answer. So all those topics that's affecting us as women, anemia is common, fibroids is very, very common as well. So those topics, we can list them. Really, next, which is gonna be in March, we can talk about it. Any questions about this topic, mnaweza mkaweka kwenye kwenye WhatsApp group, and then if we can answer or give you other links for further research. Asanteni sana so much. This was very, very interactive topic. I love teaching.
Oh, wow.
And sharing my information.
Asante Dr. Ruth, asante sana kwa niaba ya Women Prayer Warriors. We are so blessed to have you and Auntie Alice and all the ladies who are here today. Mungu awabariki sana kwa kazi hii njema mlioifanya. Tunapofikia mwisho kabisa wa kipindi hiki, ni wakati wa kuomba. Nitamuomba Sister Beth Enoch atupatie ombi, hasa tuwakumbuke wagonjwa na tumshukuru Mungu kwa ajili ya somo hili la leo. Karibu Sister Beth.
Asante sana kwa neno la leo. Tuombe. Baba yetu uliye juu mbinguni, tunasema asante. Tunakuja miguuni kwako na kusema utusamehe dhambi zetu, sisi wa dhambi. Lakini kwa yote Baba Mungu, umetukumbatia kama watoto wako, kama familia yako. Mungu, tukuzwe kwa wema na ukuu wako. Jioni hii ambao ni usiku kwa wengine, Baba Mungu, tunasema asante kwa ujumla tuliokuwa nao. Asante kwa wanawake ambao umewachagua na mkono wako kuungana usiku huu na kujifunza kuhusu mambo yanayotupata sisi wanawake, sisi binadamu. Lakini kwa yote, kama waliochangia mafungu yote ya mafundisho ya jioni yako Biblia. Baba Mungu, tunasema asante kwa ujuzi ambao umempa Dr. Ruth, Alice na Dr. Maria na wanawake wote ambao wana ujuzi leo waliochangia kwa ajili ya afya zetu. Baba Mungu, tunajua hekima na busara imetoka kwako, na tunasema asante kwamba kikundi hichi tunabarikiwa sana kwa sio tu kujua neno lako, lakini kujijua miili yetu. Hiyo ni baraka ambao wengi hawapati tena kwa bure. Baba Mungu, tunasema asante. Wengi ingebidi wapate ufundisho kupitia kwenda kwa daktari kulipia, lakini Baba Mungu, katika kila kikundi umeweka watu ambao wanakutumikia hata kwa afya. Kwa hiyo Baba Mungu, tunasema asante kwa neno la leo na maneno ambayo tumejifunza, afya ambayo tumejifunza. Baba Mungu, wanawake wote ambao wako hapa wanakutukuza kila siku, wanakutumikia kila siku. Wabariki wao na familia zao, watoto wao ambao wengi wako mashuleni, wengi wako makazini, wengi wapo sehemu mbalimbali. Baba Mungu, wakumbuke, na wale watoto ambao umezaliwa karibuni, wakuze katika kiganja chako cha usalama chenye neema na rehema, kama tulivyojifunza leo katika wiki la maombi kuhusu neema na rehema zako. Baba Mungu, tunasema asante kwa ujumla kwamba tunaweza kuja hapa na kukumbuka wale ambao ni wagonjwa kama waliotajwa Grace katika kundi hili, na yule ambaye yuko India. Baba Mungu, pia tunamwombea, lakini sio mgonjwa mmoja, tunaombea wagonjwa wote ambao wako vitandani. Lakini Mungu, hatujisahau sisi pia ni wagonjwa, either wa kimwili, wa kiroho, sometimes emotional. Lakini Baba Mungu, tumegundua wewe ni daktari wetu. Tunakuja ili tuponye wote kama wanawake ambao ni kioo cha jamii. Usiku huu Baba Mungu, tunakumbuka wale ambao wamefiwa. Baba Mungu, tunaomba wape faraja kubwa, uwapoze katika hali ambayo sisi binadamu hatuwezi. Kitu tu tunachoweza kuja ni kuomba kwamba wanapoumia wenzetu na sisi tunaumia, wanapoumwa wenzetu na sisi tunaumwa. Kwa hiyo Baba Mungu, tunaomba uwape faraja wafiwa, lakini hatutaki kutukuza kwa uponyaji ambao unaendelea kwa wale ambao tumeombea na tunaoendelea kuombea. Waponye zaidi, tukimkumbuka Vanessa Sangiwa, kuna Grace ambaye ametajwa na dada mwingine ambaye ametajwa, na wote tunajua umewaponya na tunasema asante. Baba Mungu, tukumbuke katika shida zetu za hapa na pale, makazini, majumbani. Baba Mungu, tunajua umekaa katikati yetu na upo na sisi. Asante sana kwa kundi hili, tunalikabidhi mikononi mwako kila siku, kwa kujua kwamba wewe ndio umelichagua na unatupenda na unatupigania. Lakini kwa yote tujivute karibu na wewe, tulitukuze jina lako. Kama kuna vita zinaendelea, Baba Mungu, wakumbuke wanao wapo vitani. Kama kuna magonjwa, kuna mafuriko, kama California mvua imenyesha ni baraka, lakini tunajua kwamba kuna majanga ambayo yametokea. Lakini wewe kama Mungu uliyesema kwamba utakuwa na watu wako, tunaomba uwe nao. Kama kuna any natural resources zinatokea duniani, Baba Mungu, wewe ambao ulinena ikaumbika, ukaweza kusimamisha storm kwa kusema, Baba Mungu, tunaomba kipindi hichi chote mpaka mwisho uweze kunena, bahari iweze kutulia, uweze kutulia, na vyote ambavyo umevumba Baba kwa mapenzi yako uweze kuwa Mungu katikati ya majanga yote. Tunajiombea sisi, saa zingine tunajisahau kwa udhaifu wote wa kitu chochote. Baba Mungu, yale maombi ambao ni ya kimya, wewe umeyasikia na umeyajibu na umetenda kutokana na mapenzi yako. Baba Mungu, asante kwa yote. Asante kwa kila mwanamke ambaye yupo na hayupo usiku huu. Wabariki mpaka mibaraka wasiweze kuwa nayo, mpaka wasiwe nafasi ya kupokea mibaraka, kwa sababu ni mingi. Asante kwa kusikia maombi. Jina lako litukuzwe, kwa jina la Mwokozi wetu Kristo. Amen.
Amen.
Amen. Amen.
Amen.
Amen.
Asante Sister Beth kwa kutupatia ombi la kufunga. Basi niseme kufikia hapo tumefika mwisho wa kipindi hiki cha leo cha kukutana siku ya Jumatano. Kwa niaba ya Women Prayer Warrior, nipende kumshukuru Dr. Ruth Ogot, Sister Alice Muha na wachangiaji wote wakiwemo Dr. Maria na pamoja na Sister Kay na wengine wote ambao wamehusika katika siku ya leo. Basi